Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today I have with me for the Conversation with Cancer Experts series, Dr. Krina Patel, who is a multiple myeloma section chief and research lead at a center that requires absolutely no introduction, the top-rated cancer center in the United States, UT MD Anderson Cancer Center. We're really privileged to have her. Welcome, Krina.
Thank you so much. I'm really excited to talk about my favorite things today with you.
Yeah, so you obviously were the discussant at the ASCO meeting on some of the key abstracts that were presented there. So you gave the expert opinion. So we'd like to, once again review how you saw some of the key research presented there. So to start out, obviously your, overview was focused on the BCMA CAR T cells, and it was in two disease states. There was myeloma and some of the first data to emerge in amyloidosis. So to set the stage, so where are we with cilta-cel in relapsed refractory multiple myeloma? That was one of the key presentations that had a lot of conversations going, both in the lay press and in academia.
Yeah, no, I think the late present, like what the final sort of 5 year progression-free survival, which I think we're going to talk about soon, was really exciting because in myeloma we used to say we didn't really have functional cures except for those patients who got stem cells and then weren't on maintenance for at least 5 years and did well, which is great. But again, the majority of our patients stay on treatments forever, so I think that was really exciting to talk about, and I still talk about it probably every other day right now. But this is just sort of a slide showing where we started in CAR T. I will say when I was a fellow more than a decade ago, I won't say how much more than a decade ago, but I had a lot of my mentors that weren't necessarily in heme, but they really thought that we wouldn't be able to target CAR Ts, myeloma with CAR Ts or immune therapy. They thought that, myeloma doesn't have these antigens. It's sort of in the middle. It's not like renal cell or, melanoma. Little did they know that there were already targets being found, and we were finding all these different ways to go after monoclonal antibodies. But CAR Ts really came out in the last 6, 7 years in terms of clinical trials, and so we have the ide-cel as one, cilta-cel as the other. I'm just showing some of the KARMA and CARTITUDE-1 data here. And then the last three, of course, teclistamab, talquetamab, elranatamab, we have our bispecifics that, again, are a little bit easier because they're off the shelf, but maybe not as potent as the CAR Ts, where we see a lot higher response rate and deep responses, and again much more MRD undetectability compared to our bispecifics. But again, just really awesome, and I think we also have more targets like with talquetamab, GPRC5D rather than BCMA, and of course there's so many more coming down the road. So again, this was just sort of that. Hey, look, that cilta-cel median PFS is 35 months almost, and to have it in a one and done patients who had 6